All right, Dr. Brent, introduce yourself and let's talk about Ketamind.
All right, perfect. Yes, my name's Brent Agin. I'm a physician here in Clearwater, Florida. Been studying functional medicine for about 20 years and started getting involved in ketamine about 8.5 years ago, and initially for the use of primarily depression, anxiety, post-traumatic stress disorder. But over the years, through my own experiences and through the ability to see exactly how the drug itself works, along with an ability to put people in a position to where the drug creates, almost an experience where the combination of audio and visual and isolation and sensory deprivation can put people in a position where the drug gets them into an opportunity to have some self-exploration. And it's really nice because the drug alone can reset neurotransmitters and kind of bring down the sympathetic tone, which a lot of us ride very highly in, especially women. But just based on the way the drug works and getting people to that position where you can almost reduce the inflammation that sympathetic tone can cause the brain to actually not be able to transmit neurotransmitters as efficiently as a healthy brain. On the other side of that, everybody has their own resentments and regrets and traumas to some degree. And so being able to get into a position where this drug is reducing inflammation and bringing down the sympathetic tone and causing what they call neuroplasticity, which makes the actual way the brain functions improved, and potentially even creating new neural pathways, along with 60 minutes of time where someone can have a one-on-one or a self-counseling session that can be a beautiful experience. Sometimes it can be emotional, sometimes it can be happy, but these treatments are all your experience. So there's really never a bad treatment, because at some point with your brain being very active in this position where you really can't have any obstacles into the discussions you have, you're really able to get to the core of some of the issues that you might be having, but most importantly come out of there with gratitude and a new perspective and a new appreciation of time. And when you can get to that point, people can really start to understand what they need to do to change the path they're on, because happiness isn't given, it's created. And so if people are really trying to find themselves in the direction that they really want to be on, and they're willing to do some work, it sets people off on a path that's really self-fulfilling once you get to a kind of a cruising point. And so that kind of just shows you that the ketamine isn't just isolated to people that are having symptoms of mental illness, but rather an opportunity for everybody to self-explore and find ways to be a better version of themselves.